Hi, I'm Al Walsh and I'm the pharmacist at Fertility Pharmacy Services located at the Art Clinic in Halifax, Nova Scotia. Today I'd like to talk to you about the reconstitution and preparation of the HCG trigger shot. So let's get started. As I tell you how to prepare your HCG or trigger shot, I just want to mention before you would prepare that shot that you want to wash your hands thoroughly and have a clean work surface to work on. The shot comes, or the medication comes, with a vial of HCG, or 10,000 units of HCG. It's a dried powder, and also a vial of sterile diluent as well. Okay? So, the first thing you want to do is you want to flip your caps off the top of each vial and open one of your alcohol swabs to swipe the cap or the stopper on each. So you want to get your syringe, which is a 3 ml syringe, which will be provided to you. And in this case, we're using a larger Q cap because these caps are a larger size. So the Q cap is a mixing aid that we use. And it comes with a little white cap over the threaded end. That actually has to be removed before you screw it on the end of your syringe. So this end is threaded. Be careful not to touch the end with the spike, which goes through your stopper, but it actually twists on in a clockwise direction on the end of your syringe. So in order to prepare 10,000 units, what we are going to do is we're going to withdraw 1 ml of your diluent and you're going to add it to this vial, which contains 10,000 units of HCG or the powder. So I'm going to pull my plunger of the syringe up to the 1 ml mark, and I'm going to snap that over, make sure it's snug on the top of your vial of diluent, and you're going to push the air in to create a positive pressure. And then as I release that, I will be able to take out 1 ml of the solution. So I usually pull it a little bit farther than what I need, and then I push it up to my 1 ml mark. And I'm going to roll my vial of diluent off the top of that Q cap, and I'm done with that. So now what I'm going to do is reconstitute the powder in the vial of HCG using that 1 ml of solution. And so I want to make sure I have a good snug fit over the top as well. Support your vial. And I'm going to inject that diluent into the vial to mix the powder. I'm going to mix it by gently swirling. So that powder will actually go into solution. Next, I want to turn the vial completely upside down, or a syringe with the vial on the end, and I want to remove all of the liquid that's in that vial. So I'm pulling it down so I just get a little bit of air on the top, and I know I've drained every bit of liquid that's present. So now I have the 1 ml of diluent that I started with dissolved in that my 10,000 units of HCG. At this point, I want to get rid of any bubbles that may be present. And as long as you keep your needle upright, those air bubbles will go to the top. Now I'm going to unscrew my large Q cap. And I'm just going to remove any air that's present by pushing the air up until I get a bubble at the top. Now I'm going to open my 1/2 inch subcutaneous needle, and that just threads on the end of the syringe. Make sure it's a snug fit. And I'm going to make sure I get a little tiny bubble at the very top of that needle. There. I'm ready to inject. So for my demonstration today, I'm going to inject this injection pad, which I would prepare like your skin by using an alcohol swab to swipe or clean off the surface of the skin. And then you'd let it dry to avoid any excess stinging. And the injection is, the needle will just be pushed in all the way through the skin. And then as you count to 10, you're slowly going to push the plunger all the way down to deliver all the medication. Now after you've completed that, I would say wait 10 seconds before you remove the needle from the skin. And then you want to have a tissue close by to gently massage that area. Perhaps there may be a drop of blood or a drop of the medication that's present, but by gently rubbing that area with a tissue, clean tissue, that will help the medication disperse among the cells. After you're finished, you want to take all your sharps and dispose of them properly in your medical waste bag.